we had bleeding in part of the brain right through here, and now it's bleeding into the ventricle. And now this one has a line through it, and that should be the midline. And we see it kind of pushing off to the left side just a little bit. And come down, and there's still more of that bleeding, and this is the biggest that they had in the pictures.
This would be going down from the top of the head down.
Yep, we're going down.
Now this is the original.
This is the
CT,
original.
okay.
And so we see more of that bleeding going on there, more that ventricle. Now we're getting to what we call the third ventricle. We're seeing more of that blood. Still see some there. And then we make it down to fourth ventricle, down into that spinal column. We see some more of that blood pushing down, all the way down there. And once again, normally, sorry, I'm going to jump back to the top real quick. We see more of those.
The gyri, whatever.
Yes. And when we come back down here, we can see some normally along the bottom, but because there's all that bleeding and it's pushed, we're losing some of that differentiation. So now we'll come over here, which is, so this was on the 5th at, where did they put the time on this one? At 11:30 at night, and this one was 3:30 the following day. So right through here, once again, we're losing some of that, and then you can see some more dark areas, which is part of that swelling. We see the blood. Once again, the midline. It's fairly equal from left to right, but once again, that blood, we see it in part of the brain, and then the ventricle, that ventricle pushing over just a little bit. It goes all the way down. And it's the same kind of thing, that blood all the way down to the bottom. And this, I would say, is roughly about the same, if not maybe a little bit darker in this area. I mean, there's a little bit more.
So when does the worst swelling occur after one of these?
Usually 3 to 5 days.
3 to 5?
When day 3 is usually the worst, sometimes up to 5, but that's when we should see the peak effect of it. And so, you know, as we continue with imaging, eventually we should see that swelling go down, and then the blood would, her body would reaccumulate that blood and get rid of it. And that can take months to do. Does that make sense as far as the imaging? Okay.
So it sounds like the bleeding has stopped.
Yeah, it has stopped, has not gotten worse. So, the first thing I would see, as far as neurological wise, would see, you know, a decline in that, and we would repeat imaging, and if it were to get worse.
Are her pupils still pinpoint?
Yeah, they are still pinpoint. They're still sluggish, right? Not quite as reactive
There
as
is
we'd
some
like.
reaction, but they're pinpoint.
Yeah. So my question is, or looking forward as far as like a prognosis, her left side, I think, will be fairly weak. It's hard to say I can't guarantee 100%, but there's a very high chance that that left side she'll have permanent damage to where I don't know how much she'll be able to use it. The right side, hopefully, going back up, this right side where it's not quite as compressed, there's not the blood there, she'll be able to use that right side more. But odds are she'll be very dependent. I don't know what her baseline was before this.
Ambulatory and
Stuff like that. So as far as that, I don't know how what her baseline would look like. But there's a good chance she'd be dependent, whether that's wheelchair, walker. I'm not a neuro expert, that's why I was hoping they could put it on and tell us exactly what they would say. But
So,
left side.
as far as the tube and ventriculostomy for drainage or anything, is like in the next week?
So
trait,
we-
that kind of stuff?
We talked to neurosurgeon when she first came in, and we talked to him again yesterday, and because there wasn't any increase in bleeding, they didn't feel like she was a surgical candidate to do an intratracheostomy where they would drain that blood.
Okay.
And so we would just do medical management, trying to keep her blood pressure down, and we had her on the 3%. Her sodium levels have gone up, and when I say 3%, that's 3% sodium. Normally our blood's about 0.9%. We give that sodium, it pulls fluid in, decreases that pressure in the brain.
So they didn't think they needed a bolt to monitor her cerebral pressure?
They didn't feel like it. Mm-mm.
Okay.
And so, going from here, as far as like trach, we could try to extubate her. There's no guarantee how well she'd do, and if she did not succeed with that tube coming out, she'd need to be intubated, and that's when we do the tracheostomy.
Okay, so you would actually give her a trial without, just to see how she did?
We could try that, yeah.
No, I'm just asking what you would routinely do.
It depends on how much they wake up. Right now, she's still pretty sleepy, so I would have a hard time trying it right now. Maybe another day or two, she'd wake up. It just depends on the clinical course. Sometimes we try it, but if they don't wake up, then sometimes we just trach them.
Okay.
And given the extent of her stroke and how sleepy she is, right now, if we wanted to pull it, I would say I'd prefer to do a trach, but we could give it a few more days, and if she'd wake up, then we could talk about that. As far as feeding tube, we haven't placed one yet. We'd place one in the nose. If we extubated her, we could see if she could eat. Right now, with her being as sleepy as she is, she probably, once again, would aspirate, and she would require tube in her
Tube,
stomach.
yeah.
Peg tube.
And then, long-term care, like, if she did need a vent, is there placement for her up in this area, or where?
So if she didn't need the vent, she could go to one of the skilled nursing facilities here in town. If she required a vent, she may need, there's what we call long-term acute care hospitals. And the closest one is in Vegas, or the other one's up in Provo, thank you. So depending on her needs, she could maybe end up around here, but if not, it sounds like Vegas might be.
And what about stroke rehab? Is there?
There's a stroke rehab facility here in the hospital. It's on the first floor, but for that they have to be able to participate in 3 hours of rehab. And right now she wouldn't qualify for that rehab.
Just trying to read the blood pressure. Where is it at?
Sorry, our line
Oh,
140.
okay, yeah, there it is, thank you. All right, so have you had to use anything to keep the pressures controlled?
Yeah, we've been using clofidipine.
Okay, and, okay, what would be the oral treatment for that if you were using IV?
We could start like with amlodipine or like lisinopril.
Okay, but that'd have to go through like a big tube or something, yeah.
Yep. So, with that all being said, it sounds like Kaisley talked to, was it Herb?
Yeah, that's me.
Right?
Yeah.
About maybe possible comfort cares.
Well, that's what we need to find out, where we're at here with her responses and that kind of thing. But,
Right.
it's a long, long road at this point, and the question is, is that the way to go? I mean,
Right.
so, it'd be interesting to hear what the neurosurgeons or whatever say about recovery from this type of injury
Right.
in her age group.
Right.
And, it's usually not very good, but,
Right.
and then the other thing is that at 7 to 10 days, when the blood's reabsorbing, that causes some other issues with the brain that can make things a little bit wonky, and then there's neurogenic pulmonary edema that can occur, and a lot of other
Right.
things affecting brain function that can happen now in the next week or so,
Right.
but it'd be nice to, I don't know, what's Dr. Sutherland, is he internal medicine?
Yeah. Yeah.
Okay,
Yep. He's a trauma
Right.
surgeon, critical care trained.
okay. As far as cardiac though, she hasn't exhibited any neurocardiac symptoms?
Mm-mm.
Alright, looks like right now her lungs are good, 98%.
Yeah.
And,
50%
how much oxygen is she on?
30% now.
Okay, so,
She's on pressure support by 1.5, just minimal.
so she's currently triggering all of her respirations?
Mm-hmm.
Okay.
Yeah.
They got a room, if we wanna go down and talk, there's another room down around the corner.
No, that's fine, this
I
is
think
just
'cause she's
basic
like-
vital signs.
She's listening to everything we say,
That's fine.
that's fine, and
Yeah,
I'm glad.
I'm just learning what's going on with
Right.
her right now, and
I
right
understand.
now, she's pretty solid.
Right. And that's the thing is, like I said, as far as like airway, she's managing to trigger all her breath. It's just if she, with how sleepy she is, would be concerned if we were to excavate her right now.
Yeah, is she putting out a lot of NG, or is her gut actually working some?
It's putting, I mean, that was 400 for, looks like another 300 today. We haven't started feeding her because we're kind of waiting on this to see
Yeah.
what our goals of care were.
Well, we got a lot to talk about.
Yeah. Any questions or concerns from anybody?
Not that I'm too dumb to ask questions.
No. Any question's a good question.
You're not too dumb, Roddy.
No. Okay. Well, I'll leave you guys to it. If you do decide if you have any more questions,